the healthcare board is more important now than it ever has been. Their leadership has really been a testament to how all boards should really position themselves going forward. And that is just so unique and inspiring, and we're so grateful for their leadership.
They provide that combination of cheerleading and coach and expertise to help guide decision-making and setting vision for the hospital.
They set our goals, they drive our priorities, and they help us keep the patient first. And I've appreciated that all the years I've worked here. I've been proud to work for an organization that made our patients the center of it all.
Many of our board members did not have healthcare backgrounds. They came from for-profit businesses, so they would share that expertise, and that really helped us over the years.
And with that expertise, it was nice to watch them understand their fiduciary responsibility to put the organization ahead of themselves. And the benefit we got out of that is really engaged boards that help us elevate who we were and who we are going to be in the future.
To be an independent health system in a very competitive market and be successful as they have is unheard of. They have cared so much about not only the system and success of the system and the community that they care for, but how everyone does successfully individually, and which is really a testament to their leadership.
There was a time where one of our board members, and then he had his colleagues as well, really were pushing us to look more into the physical security of our staff. And that really began a great conversation that we were able to have with the board and the rest of our leaders.
I'll never forget when we came with the plans, we were ready to start actually building the hospice house. And some of our board members looked at those plans and said, this isn't good enough. This isn't right. This isn't what we had in mind. And we almost started from scratch with the design of that building. When I look at that, I'm so glad that they spoke up at that time.
One of our board members led the first Moon Over Miami event 10 years ago to support the hospice house. And that single decision has led to 10 years of fundraising, charitable donations to our system for various projects that wouldn't necessarily have been able to be funded, but with the support of the community have been able to be possible.
We were getting a lot of pushback at the time from some of the larger facilities in Kansas City. They did not want an open heart program in Olathe, Kansas. And I think what we saw from a board perspective is a knowledge that we had the players and we had the volume, we had the population here to support an open heart program. The board was rock solid, they were very cohesive, and we moved forward, and then that caused all boats to rise. And we knew we had to perform at a higher level in order to produce superb results, and we accomplished that. We did a great job.
We had trust inside each of our boards to where people knew they could speak up. And when they could do that, it really made a difference on the impact we had and the confidence we had on the decisions that were made through the boards.
The strength of the board over the years was the diversity of opinion. And I think that was very healthy, and I think it made it a better organization over the long haul.
They have always put our associates and our community first. And I think back in 2020, when we had to shut down our surgeries during COVID, they were always calling, always concerned with how our leaders were doing, how our nurses were doing, how our providers were doing.
So it wasn't just a side volunteer job. They were really committed all the way down to their hearts to this organization and to it being successful, not only for the community, but for themselves and their own family members as well.
I'll keep saying this, but it's caring. They really cared about us doing the right things for our community. And that, I think, is the number one thing that they brought, and a tremendous amount of honesty and integrity and accountability for what we are here to do.
What I saw over the years is people who were truly invested in their community without one penny of compensation, ever. And they would give and give and give.
The decision to join the University of Kansas Health System was a tough decision. I mean, this was a board that was very proud of the independence that we have had for 70 years. But if we wanted to thrive, we needed a partner. And so that was a very, frankly, emotional decision And as some of them have said, that we're literally turning over the keys to what we've built here. The decision to make that change, to join the University of Kansas Health System, give up the independence that had been held for so many years, truly was courageous, but they knew it was the right thing to do for healthcare to thrive in the communities that they supported. And I think that's their legacy. They can hold their head high knowing that they made that decision.
It was sacrificial. It was self-sacrificial to look for the greater good, for what is best for our community, what's the best for our long-term growth. And they really modeled that for the rest of us, and I really appreciate it.
I think this relationship with the University of Kansas Health System has the ability to be the most dynamic change in healthcare in our community for generations to come. And it's all due to the courage and thoughtfulness and leadership that our board member has provided over the last 70 years.
It has been my honor and privilege to serve along the board members since I have worked here at Olathe Health System. Just so proud of our board and the legacy that you have made, the sacrifices you have made to leave excellent healthcare in our communities. The fact that many of our board members, family members actually started Olathe Medical Center or Olathe Community Hospital all those years ago. It's something that's pretty unique, and it's been my privilege to be a part of that for all these years. And thank you for your service.
I'd like to say thank you to all of our board members for all that you've done to support this community and this organization. I have been inspired by you and your commitment, and I say thank you very much.
Your efforts have led to great improvements in patient care and taking care of our community, but also established a legacy of excellence that we are so looking forward to continuing as we move forward.
If I could say one thing to the board members, past and present, is thank you. Thank you for your leadership over the last 70 years. Thank you for your integrity. Thank you for your thoughtfulness, and thank you for your friendship.
The sacrifices of your personal time, the sacrifices made by your family, the vision that you shared, your work experiences that were shared, and just sincerely want to thank you for a job well done. It was above and beyond. Thank you very, very much.